Aho, kitipilo hele, yesipi yayani, lasawanwa.
Hello, and welcome to Among the Shawnee, a podcast for absentee Shawnee tribal members. I'm your host, Mindy Longhorn, Media Director for the Absentee Shawnee Tribe. Hello, everyone. Today we are going to talk about open enrollment for Medicare and Marketplace, and we've got our resident experts here with us today. We've got Connie Bottaro, Patient Benefit Manager with the Absentee Shawnee Tribal Health System.
Hello.
Along with Al Triggs. He's a contracted benefits advisor with Legacy Tribal Services. That's a lot to say. And we've got Janette Tyler, who's a healthcare social worker, also with the Tribal Health System.
Hello.
Welcome to the show, guys. Well, actually, welcome back.
Thanks for having us.
Connie and Al are return guests. You were on back in October 2024.
Mm-hmm. Yes, and that was awesome.
We were audio only. We were sitting in here at a folding table. Do you remember?
I do.
With the chairs. I think we had almost like lawn chairs. It was just a whole different setup. So now they can see you.
Now we have, what do you call these studios? I'm curious. AST Media Studios?
Podcast studio.
Podcast studio.
Mm-hmm. It was a lot different than when you were here before. Mm-hmm. So now you're kind of old pros at this. So... and your episode, if someone's wondering, was October 2024. We really got into the meat of Medicare. So we're not going to get into that today. That's a lot of stuff.
Right.
That's a whole other episode.
So if you do want to know more about the ABCs and Ds of Medicare,
it's on the website.
Check out last year's
or
podcast.
Anywhere where you get your podcast platforms. Right. It's still out there. Right now, as we're filming, the government is shut down. Today.
Yes, unfortunately.
Unfortunately. But we don't know how long that's going to last. Could be another day, could be a week, hopefully not long. But this open enrollment is still happening regardless, right?
It is.
That's not stopping.
Fortunately,
and
it is.
The coverage is still happening too, right?
Now, there's other programs that are being impacted that we will touch on. And Janette can talk more to that about SNAP.
Open enrollment
as far as
happening.
we kind of cross over with federal and state health insurance programs and DHS and Social Security services, Janette and I and Al. So we're going to talk a little bit more about that too later.
Okay. But it's still happening because I know everybody's like, it's shut down. This is still happening. So this is a really busy time for you guys. So I'm glad you were here. There's some big changes coming up in 2026.
There's quite a few.
And that's going to affect a lot of people.
It is.
Do we want to start with Medicare first?
Yes, since we are already in the Medicare Open Enrollment period, and that runs from October 15th through December 7th every year. And that open enrollment period is actually to enroll in either Medicare Advantage, a Part D RX standalone plan for just strictly drug coverage, and then also if someone wants to switch back to traditional Medicare, that is what this enrollment period is for.
So you can make your changes to your plan.
Yeah, and Al, our contracted Medicare advisor, assists patients with that as well as PBAs can help a little bit. But if someone is interested in exploring their Medicare Advantage plan options or Part D drug plan options, Al assists us with that.
Yes, and I'm a broker, so I represent all the companies out there. So just know that I've got a pretty full palette.
So you'll get what's best for you, really, then. Is what you need, because everybody's going to be different.
Yeah,
Correct.
And the goal is to actually help someone with the plan that is most appropriate for them. It is not that one particular company, that we're kind of steering someone to one particular company. No, we're steering someone to the best benefits they can get.
For you, right.
So we assist with their Medicare options. There's different ways that they can go with their Medicare options, whether they want to stay traditional Medicare, pick up a Medigap supplemental plan, pick up a standalone Part D plan, or go into a Medicare Advantage Part C plan. PBA and Legacy Tribal Services assists with that. So there are some changes coming on the Medicare front. I think probably the most important one that everyone's going to want to know about is how much is the Part B premium going to be?
So yes, the premium for Medicare, unfortunately, is going up next year. It is projected that it will be $206.50. Now, with the
That's
government,
monthly?
Yes, it is.
206.
Now, with the government shutdown, we do still have some clients are receiving letters stating their withdrawal for 2026 will be 185, which would reflect not an increase, but we think that is probably because of the government shutdown that information hasn't been able to update and therefore get out to the Medicare beneficiaries.
So
And
we
then
need to
the-
know.
Yeah, and then the Social Security cost of living increase, well, and veterans would get that too. We would just say the cost of living increase is projected to go up 2.6 or to 2.7%. So that would absorb that extra. It's about $20.
$25.
Yeah, higher in premium cost. However, the cost of living increase is going to be contingent on the federal government shutdown.
And we don't know how
Unfortunately.
long that's going to go on.
Yeah.
We don't know. We're in the third week, I think.
Correct.
So
We're in
we
week
don't
3
know.
right now.
Okay. So this is still kind of contingent on that.
Yes, and we have this, we have this saying called help yourself, help the tribe. What exactly does that mean? You know, these plans, they particularly help the individual because they will give them a few more benefits than what they are used to having. A lot of them even give a gym membership if you're so inclined to stay in shape. These companies really want to promote you being healthy and in shape, and that's why they offer a gym membership with these things. And help the tribe. The tribe gets reimbursement on medicines that tribal members take. And the greatest thing is that they get reimbursed more than what they spent. So that is how it actually helps the tribe as well.
Yeah,
And
we
it
probably
helps
should do a little home health plug though. So when we're assisting patients in their plan options, we do want to mention that that home health services sometimes in the Medicare Advantage plans can have limited visits. So the traditional Medicare would cover more. So I did want to mention that.
If you rely on
Yeah.
home health and it is something that you need and you're going to need year round, it may be best to go traditional just because some of the plans, they limit your visits. And after you finish that, you're not guaranteed anymore.
So if you really needed that, but that's where you guys come in, right?
Yes, that's
Yeah.
where we
You would-
come in to try to help, but they cannot change their plan in the middle of the year.
Only during the open enrollment, right?
So typically what happens is when someone's 65, home health care, that's the last thing on their mind.
Right.
I mean, as far as they're healthy, they probably don't take medicines. So this is something that a person has to keep in mind in the future. And one thing about it is, you know, a person can always come out of a Medicare Advantage plan during open enrollment season in order to accommodate, you know, getting back on original Medicare and thereby having more home health care.
If they need it. But you're right.
if they
When you're
need it.
65, you probably aren't thinking, I might need home health.
But one more thing, and that is we're talking about, on average, 3% of the population has to deal with home health care. So it's not that everyone's going to have an issue with home health care or even need it. You know, so
And that's why it's good to sit down with Al when you're going on Medicare, changing your plans, and let Al know what your needs are. And then he can help steer you to the right plan.
exactly.
Right. So we have to make sure the plan's going to work
For you.
Yeah. Well, and the patients.
Right.
We have to get a list of their specialists. In some cases, their drugs. And that's the other thing. Even though the drug, plans don't really impact our tribal population as much, there are some changes to the drug coverage that's going on. That's
Yeah,
gonna
we are
be
seeing
impacting
some of these companies where they've always had a consistent copay for Tier 3, which is a name brand drug. They're going to a percentage. To me, I would rather pay $47 for a Tier 3 name brand drug instead of 20% of a potential $600 medicine. So that's something that we're going to have to kind of keep an eye on.
And that's going to affect a lot of people too, though, as well, I would think.
Yeah. So another point I wanted to make, and I know hopefully there's some AST tribal elders 65 plus out there, and I'm really proud of this program, and to say that we do assist our tribal elders and reimbursing their Part B premiums.
I know, that's phenomenal. I think
It
we
is
need to plug that right there.
fantastic.
And that
Yes.
AST is the only
Tribe, that's right.
in the
Yes.
country.
that
So
does that.
That's huge.
That is huge, especially if it's going up.
Yeah, you guys should be really,
I
really
think
proud
it's,
of that.
That's a big thing.
It is. And we're coming up on our renewal period. So all of our elders will need to renew every year for that program to continue to get the reimbursement on Medicare Part B.
So even though they're already, maybe they're happy with their plan, they don't want to make any changes, they still need to renew
Yes.
if they want to get reimbursed, which
That's
who wouldn't, right?
Yes.
Yes. And especially with it going up.
Right. That's $25 every month. So, and that has to be done during the open enrollment periods, correct?
Yes. So, the deadline to renew is December 31st.
Okay. But I
Although
know
it can spill over into January because we have to have the latest Social Security statement showing the 2026 Part B premium reimbursement. So, because this is, I'm going to stress, a reimbursement program that has to, they have to pay the Part B premium, and then we
Get reimbursed, right?
yes.
If you didn't know, the
reimburse
tribe
back.
will cut you a check, right? But they do take
Yes.
it out first. You're right. And then
Yes,
you
so
get
we have
reimbursed.
to have proof that you are paying, our tribal
Right.
elders are paying that reimbursement.
before you get
premium.
reimbursed.
The Part B premium,
Right.
sorry about that. So sometimes the renewals do spill into January because some of our tribal elders don't get their statement from Social Security till January in some cases. So, but we're, we work with our tribal elder population and making sure
All the time.
they
so
can
you
get
know.
renewed as
Yeah.
quickly as possible.
So you help them.
Yeah.
As for those that are not blessed to be a part of the absentee Shawnee tribe, there are ways for them to get their Part B paid as well, and it's called the Medicare Savings Program.
Well, I'm glad you brought that up because
So what is that?
yeah, you cannot be if you're eligible for this program, you cannot get the reimbursement. So
Right.
So it's one or the other.
Exactly.
Okay. So what is the other one then?
The Medicare Savings Program is where the state of Oklahoma is responsible for paying your Part B premium.
Okay.
And please know there are a lot of people out there, possibly you listening right now, that qualify for the program and have no idea. And I have to say, it breaks my heart when I run into someone that's qualified for the program for 7 years
And they didn't know.
and they had no idea. And a gentleman came up to me at Little Axe and we discovered this. And it doesn't go back and try to give you that money back. It's just a program
From now
going
on.
forward. So please, if you think you may slightly even qualify, and Janette can let us know what those numbers are to actually, see if you may qualify.
So is it income?
Actually,
What,
it's
what
there's-
would,
there's
what would make
both,
you?
There's both income and resource guidelines.
Okay.
And the income guidelines kind of depend on if you're an individual or a spouse, it is a little higher, but they look at your income first.
Okay.
And here's what I can say for sure. The guidelines change every April with the COLA raises. And if you make $1,700 gross or less as an individual, I think it's actually $1,738. I'm not sure.
15 a month or under. Yeah.
You qualify with your income.
Okay.
And then the resources are like $9,900 as an individual.
Yeah, you can't have anything that can be liquidated to cash.
And resources, that's like
in that
property
amount.
that's not attached to your home.
Oh,
That's
okay.
a resource. Bank accounts, 401ks, life insurance that has a cash value.
You can't go over
burial
90.
that has a cash value.
Okay.
Anything that basically has a you can turn into
It's
cash.
into cash. Okay.
So
if you
anything
did
that can be
not-
liquidated to cash over 9,990 that will put you over in resources is what we call that.
What about your car?
You can have one car because
one
they
car.
look at you do have to have a place to live, so your house is exempt,
And your car.
and you have to go to the store and to the doctor, so one car is exempt as well.
Right. And the married couples would be 2 cars.
cars.
And
Yes,
the
2
home.
cars, and the
house.
married
Exactly.
couples, it's a little higher. It's
It's
over.
right here. It's 2,320 a month. And then the individual The Medicare recipient has to be eligible in their own right at $1,715 a month. So
Okay.
make it
So
a little
that's-
harder for married couples.
And they can if they
Unfortunately.
have questions, like Al said, they can call me. I help with all of that. They will not be on their own. They can call me, come in, because they will have to provide like bank statements, IDs verification, and then we can do the application.
So that, I mean, there might be a lot of people that don't know that they could get that paid for.
Exactly. If you're out there right now and you've just heard this information, tell everybody to tell everybody.
To call you guys.
Because, you know, it
Right,
like I
it
said,
could
it
save you
breaks
some money.
It breaks my heart every time I run into someone that's, even if you qualified for the program 6 months ago, that's 6 months the state of Oklahoma should have been paying your Part B
Right.
premium.
And they will not go back. The state of Oklahoma will not. And then it starts from the date of application. And that application can sometimes, depending on how long it takes to get things done,
Probably
with
months.
But once we get it approved, and that's what I'm going to help do, they will actually go back and reimburse you for the date, the month that you applied.
Okay, so even though you were paying this for 2 years, maybe, if you applied 2 months ago, you would still get back paid for that, but
that.
not for the years that you. Okay.
Exactly.
Correct.
But it still could save a lot of money.
Going forward, it could save, you know, if we're talking a couple both, 200, you know, that's $400 a month.
That's substantial, especially if you only you're on a fixed income already, and then you're losing, like you said, 400
Exactly.
or 440 or whatever the number is. So that's really important to know. I think there's a lot of people that we didn't touch on that last time. So
Yeah,
So
and if
there-
you're
Oh,
go ahead.
No, you go. You go.
Well, and if their income is, you know, closer to about $1,200, they may qualify for the highest level of Medicaid, and with that, there are certain special Medicare Advantage plans that can bring in a boatload of more benefits, even dollars, into your account that could help you pay for things like utilities or groceries and so forth. So it's definitely worth your time just to make sure
It's
if
worth
you do
just
qualify.
checking into because if you are eligible for their top tier, there's tons of benefits, and their lowest tier, it's going to save yourself $200 a month.
Exactly.
with
Yeah, and there's
everything
another
going up,
program actually in the so there's Medicaid, there's Medicare Premium Assistance, and then there's Social Security Extra Help. So they're the three low income subsidy programs that we assist our patients with. And if you're interested, we can help. We always help assess all of our, when our patients walk in the door, we assess them for all programs.
So you know what's out there
Yeah.
because the general population wouldn't know about these things.
Yeah. And the great thing about it, even if they're eligible, so Social Security Extra Help is
What
the
is
highest
that?
income threshold. So that helps cover, yes, Medicare Part D, it helps get lower costs on their drugs for Medicare Part D,
Okay.
where it could be a lower copay. I think they only pay actually $4 for generic and $10 for brand fills.
Then also, depending on their income, they will not have a Part D cash out of pocket charge.
Oh, okay.
And so, but my point being, bringing Social Security Extra Help up too, and Al touched on it, but they could actually get into a very robust Medicare Advantage plan at zero cost, whereas there might have been a premium on that plan because of the more robust benefits that are on that
So
plan.
that's a lot of extra help.
Yes. So even if you're over income for the lower income threshold programs,
You still might be able to help them.
yes.
To get some help.
Yes.
Correct.
Okay. Wow. That's good. See, they really need to come
Yeah.
and see you guys.
And so I also wanted to touch on the other open enrollment period that we have.
Okay, we've got two going on. Well, what's the other one?
Yes. So Health Insurance Marketplace,
Okay.
which is like, i.e., you use the slang term, Obamacare.
Okay.
So Health Insurance Marketplace, every year there's an open enrollment period that starts November 1st. It usually goes through December 15th, but under the American Rescue Plan and Biden Inflation Act was expanded through to January 15th. So this is the last year, unless everything's reauthorized,
Who knows?
that it's going to go to January 15th. And there's a lot of special protections and provisions for Native Americans that the Affordable Care Act helped, reauthorized a lot of the Indian healthcare Act provisions and protections for natives. The Indian Health Care Act of 1976 was reauthorized under the ACA, Affordable Care Act. And then under the Biden administration, they expanded the tax credit subsidies and gave this extra open enrollment period. But the tax credit subsidies, which really it increased eligibility to help pay down the cost of a health plan because it's through a tax credit that's taken in advance of the tax year. Those tax credit subsidies are ending on December 31st, 2025. And unfortunately, that is a big reason why we're in the middle of this government shutdown. Because not to get political, but
that's a whole other show. And we could, right.
It is impacting.
That's a whole other show.
So it is,
it's impacting everything.
It's impacting everything because one party wants to reauthorize or refund it, and the other party does not.
And what this basically is bringing about, it's going to skyrocket premiums.
Right. And premiums are actually going up. So it's bad, really bad
So
thing.
this is not, Medicare is age related. This one's not age related,
Pre-Medicare.
right?
Well, actually, it's up to age 64.
Okay,
is the population for Marketplace.
Right. Okay, so
right,
that
because
affects...
when you get Medicare, you have to come off of a Affordable Care Act plan.
Okay, so you can't be on both.
So basically, there's a hierarchy in federal and state health insurance programs. So Sooner Care, which is state Medicaid.
Right.
So if you're over income for Sooner Care, we always, when we're assessing a patient, we look at Sooner Care. You're over income for Sooner Care, and you're not on disability, and you're not 65 plus in the Medicare category for coverage. Then we're looking at Marketplace for our patients to see. And the special protections for natives include a zero cost sharing plan opportunity where natives can basically be 100% covered in a plan with zero balance billing. And if the cost savings program, which again is in the form of that tax credit subsidy, sometimes the tax credit subsidy will pay down the cost of the premium all the way to zero. So you could be zero.
Yes, and you just did something so special for one of our patients.
Well, let's hear about it.
Tell us a little bit about it?
We need to hear about it.
It actually really does touch my heart every time I think about it. Actually, I thought about this patient this morning, and I'm like, I need to call him.
Okay, let's hear it.
And I have to credit our medical provider, Dr. Johnson, because he brought this patient to me who had autoimmune liver disease.
Okay.
It was not due to alcoholism, but his basically immune system was attacking his liver. And we tried to, he was over income for all the programs. So he was going to be full cost for the health plan premium, which push came to shove and he was basically dying. And we helped him, he decided he was going to, bite the bullet, and he paid paid the money for the premium. But the beauty of it is that we were able to get him in that zero cost sharing. Well, it's actually a limited, so it's kind of deep dive. It's a limited cost sharing plan. If natives there's two income thresholds. So if they're over income for the zero cost sharing plan, they're eligible for a limited cost sharing plan, which means they do have out of pocket. But if their referral goes through an Indian tribal facility, that they get the zero cost share. But that's easier said than done.
Right.
Mm-hmm.
So we were able to work with the insurance carrier and the transplant institute that he was a patient at. And he called me 2 weeks. This was like 2 weeks ago. He called me and he said, "Connie, I got my transplant." And I was jumping for joy and I was just so humbled that not only did he get his transplant, but at zero cost, which is unheard of.
That's millions. I mean, that's
unheard of.
I mean, that is unheard of.
Exactly.
Zero
Connie worked
cost.
hard with all of these agencies.
And it wasn't easy to get the zero cost share on a limited plan. It's been really, really tough.
That's amazing.
Their claims basically get coded to zero The carrier actually, and if I can go specific, was Blue Cross Blue Shield. And I have to say that Blue Cross Blue Shield has been, they've been a partner with the tribes like from day one.
Well, I think that's fantastic.
With their help and Dr. Johnson's help and the help of the Transplant Institute, I think it was Zudi Transplant Institute.
Good. That's amazing. Good job, you guys.
It's a big story. Now, I'm hoping so in those plans, like I'm hoping that hoping the anesthesiologist wasn't out of network or something like that. Like, so the plan will pay if it's out of network, the plan will pay up to whatever, the plan pays. So he's still getting covered.
That's phenomenal. At zero.
It's amazing.
Wow.
So, and if I can say that of course, because of HIPAA, I can't bring up the patient's name, but he was told he wasn't going to see his 35th birthday. Oh. And his 35th birthday was last week.
Oh my goodness.
So I was so excited. I know.
My
whole body tingles when I talk about it because my vibration just goes through the roof.
So has he had is he having the transplant soon?
Already had it.
Already had it.
Already that quick? Mm-hmm. Oh, I figured it would take months.
Well, me too. Well, he told me that they called him on a Friday. Wow. And he was told to, get ready to come to the hospital tomorrow. And then he got the call on Saturday and they said, make your way to the hospital.
Wow.
And it was that fast. He was literally in the plan for 2 months. And that was just a miracle. Wow. Just a miracle that he got it that fast. Mm-hmm.
That's
so
amazing.
It's a story that does need to be told, that people, I know Obamacare has gotten a lot of bad negative press, but it does save lives.
That's a lot of good.
So it does.
Right. All these programs do save lives.
Right.
Mm-hmm.
And that's what we're here to do.
Well, obviously you just proved that. So,
So. And if you're sitting out there right now with a marketplace plan, you need to be aware that November 1st will come a whole new program with new premiums. And 9 times out of 10, I've been doing this for some 5 years for you guys now, and every year I see the premiums increase. You may be paying $0 for it right now, but once it crosses over into January, it could be $200. And so that's why it's very important that sometime in November, after November 1st, to actually look at your marketplace plan and, call me and I'll be happy. It only takes like some 3 minutes to go out and look to see what the plans are doing for 2026.
Yeah, we need to advocate for that because they're doing something. There's another update on Marketplace. The $5 premium is what they're calling it.
Right. So if you don't update
fraud detection.
If you don't update your income by, I believe,
December 15th.
Yes, by December 15th, they're going to charge like some $5 to your account for not having done that.
Really?
Per month.
Every month?
Yes.
And they're putting that in place because there has been a lot of fraud on not just Medicare. Everyone knows there's a lot of Medicare fraud out there, but marketplace fraud has been rampant as well.
So that's why this
was their way of detecting fraud.
It's always good to look at it. It's a new year coming. Let's get everything current and updated. Mm-hmm. And so between November 1st and before the new year, make sure you if you're not sure, contact Al and make sure your program's updated and it's still the best one for you.
And speaking on the fraud issue, if you get a letter in the mail and it's from the marketplace, or if an insurance company with insurance cards, someone has fraudulently enrolled you, please know I had to remove probably 30 people that were fraudulently enrolled.
Wow.
Unbeknownst to them. They had no idea they had it. But when it came to us trying to refer them out, there was a blockage because this person may have Sooner Care, but yet if they've got you can't have Sooner Care in the marketplace plan as well. And so the marketplace plan has to be removed before they can have full access to their Sooner Care.
And they didn't even know.
It's horrible. And I have been in touch with the Oklahoma Insurance Department's Consumer Protection Agency, and they are advocating for individuals to file a complaint. Please file a complaint if you've been defrauded through the marketplace, because they cannot stop it if they don't have any official complaints
If
on
they
file,
don't know about it,
they can't
Right.
stop it.
But if something comes in the mail and you're an elder, maybe you think, oh, okay, this is my new cards or something.
Right.
You probably really would think that that was yours, and you would probably try to use it.
And the problem is right now with it being open enrollment, you're getting everything in the mail. You're getting all the phone calls, and they come up with new stuff every year. I've had 2 patients come in. Well, I got a call, and this is just for natives. And I brought him to Al,
they'll use every hook in the
and
book.
they will.
It's true, though.
They sure will.
They will
will.
tell you that you're eligible for food just to get you to
Change
enroll
plans
when you're
with-
not. You have to be
Right.
low income to be eligible for the food benefits on the Medicare
And
plan.
so it's
Yeah.
good to always check in with our consultant Al and make sure it is correct, it is legal, and they're not doing something fraudulent and taking you out of a plan and putting you in one.
Something else that you are
Correct.
stuck with for a year,
Yes.
potentially 12 months, right? Until you can get out of that next year.
I call it the dangling carrot.
Yes, it does.
And they're getting stickier. You're right. They
Yeah.
change their tactics, but that's
good.
another reason I'm glad you guys are doing some events, in-person events.
Yes.
Let's hear about
Let's
that,
talk
because I
about-
think that people can show up, do this in person, see you guys.
Yes, so we're calling it this year the Get Ready for 2026 Benefits event. It is sponsored by Patient Benefits Advocates Team and Purchase Referred Care. So and I'll give the dates here in a minute, but I do want to talk about what we're doing there to help our patient population. So, of course, we're going to assist with all of our patients' open enrollment options. Al and Legacy Tribal Services will be there to do Medicare and Marketplace plan comparisons. AST elders, come out and get ahead of your renewal for your premium assistance for Part B. We have Sheena Fixico, who is our patient benefits advocate, who assists me with that program. And Sheena and actually Tiffany Wicker will be there too from Shawnee Clinic to help our elders renew. And then Purchase Referred Care is needing to update all tribal members' charts. So they will be there to
CDIB cards. Probably.
Yes,
They want to
so
see that. Make sure your CDIB
please
card is
come,
correct.
bring your photo ID, your CDIB
Right.
card, insurance cards, and proof of residency. So we're doing two events. One's going to be in Little Axe, Tuesday, November 18th from 9 a.m. to 12 noon at the AST Resource Center. And then we're doing a second event on Thursday, November 20th from 1 to 4 p.m. at the AST Multipurpose Building. And for that event, we have something a little special. We have OKDHS's mobile unit will be on, or mobile office is what they call it. The mobile office will be on site to assist patients with Medicare premium assistance, Medicaid, SNAP. They
will actually be on site, and they
Yeah.
can assist with any state programs. So what I would, definitely recommend, bring your ID, bring a bank statement just in
Yes.
case, and then they can check to see if you're eligible to have your premium reimbursed if you're not
something
already
extra.
on it, or something extra.
Every little bit helps.
Exactly.
And then we're going to have giveaways, spin to win prizes, and snacks. and I
who
know
doesn't want
our
snacks,
population
right?
loves
Giveaways.
the giveaways and
Yes,
snacks.
you guys have some good prizes, by the way, if you've never been. I think you got great swag. So these are 2 events coming up in November, and you guys will all be there.
We will.
So they can definitely come out. Now they can do the income verification there too, because I know you said $5 a month if you don't do that. Can they do
The
that there?
marketplace, yes.
Right, you
we
can do that too
We
if
can
you're
do
there?
updates
Okay.
there. Mm-hmm.
Well, that way someone's not getting charged $5 a month just because they didn't verify their
Yeah.
income. Okay, I think we've covered. I feel like every time you guys are on, we just have so much
much.
information, and I feel like we just barely touched the surface.
Sure.
Yeah,
There's
I
just
mean,
so much
I
of
could
what you
speak
do.
all day long about
I don't think people want to watch us for all
I
day.
know,
But
no.
if someone needs more information, it's asthealth.org. It's under Patient Benefit Advocates.
Yes.
To contact you guys. Of course, we want you to come out to the 2 events in November. See everyone in person. Make sure you're updated. Everything is ready for 2026. And that way you can help yourself, help the tribe. I really like that little slogan. Anything else that you guys wanted to mention that we didn't touch on today?
Yeah, I did want to mention one more thing about the event is that we'll also have our Sooner Care Enrollment Sisters there to assist. Valerie Hare, Andrew Guthrie, and Addison Batman, who is our newest patient benefits advocate. So
they
we'll
can come
I'm going to have all hands on deck,
Well, they can come and meet everyone.
and we hope you come out.
Yeah. It was
get
great
some
to have you
assistance.
guys back. I think Janette's going to come back. We're going to do another show. You'll be a repeat guest. We're going to do one more with what you do.
A little bit with all the services that I offer.
Apparently, we didn't know that we
I'm like breathing
had this.
because Janette does so much too, and there's
Well, that's another show.
so much more. That's what I was going to
So
say.
we'll do another show.
There's just so much more. So she helps with Social Security disability applications, and
VA.
VA. I mean, we can go on and on. So anyway, there's
we'll
more to
have you
come.
back.
More
Right.
information to come. More really
But
good information to come.
Thank you guys, because I know this is your busy time of the year.
It is.
It's really
It
busy.
is, yeah.
So I'm glad you guys came back today. And
Thank you so much
hopefully-
for having us again.
And I have one more thing. There is a new pony at the rodeo, so to speak.
Oh, okay.
There's a new company that has come to Oklahoma County. They've been in Florida quite a bit. I'm fairly impressed with the company, but I will let you know that I'm already affiliated with that company. And so if anyone would like to know more about it, they're coming in with some pretty enticing benefits.
Okay.
And so, but like I say, it's just for Oklahoma County for now. They'll probably expand into other counties for 2027. But it is something, if it's something that you've gotten in the mail and you're curious about it, please just pick up the phone and call me. I'd be more than happy to, let you know what I think about the company and if it's something that you should consider.
Okay. That way you're not getting locked into something that's not good for you.
Exactly.
Right. Okay. Wow, I feel like this was just a lot, but thank you guys for sharing all your wealth of information, and hopefully we see a lot of people at your events November 18th, November 20th. Thank you guys, and I hope everyone
you,
comes
Mindy.
out. You have a great turnout at your events.
Appreciate
Thank
it.
you
Thank you
again.
so much.
Thank you for listening. I'm Mindy Longhorn. We hope you join us next time as we talk among the Shawnee.
Yahweh, Yesi Hakaweta Wiani, Salanoki Kenolepwa.